Pregnancy can be one of the most joyful times in a woman's life, but it can also bring up a lot of questions. The maternal mortality rate in the U.S. has more than doubled from 1987 to 2016. So whether you're thinking about becoming pregnant or already are, we're here to help you. This is What's Up, Doc? Pregnancy Edition. Hey!
Oh, wow.
It's always nice to have our good friend and Pfizer Senior Medical Advisor, Dr. Freda Lewis, all here.
Thank you.
You ready to do this, Doc?
You know, I'm always ready.
Yes, you
Okay.
are. All right, now if you plan on getting pregnant, are there any prenatal routines that one should start?
So absolutely, because your health can directly affect your baby's health. So one of the first things to do if you're planning to become pregnant is to schedule what I call a pre-pregnancy checkup.
Ooh.
So this is really important because it can help you and your healthcare provider identify and then manage some of the things that could affect you and your baby before, during, and after the pregnancy. So for example, if you have any chronic medical condition like diabetes, high blood pressure, or depression, this is an opportunity for you to work with your doctor to figure out if you're doing everything you can to manage that condition before you get pregnant.
So many people don't think about that.
Exactly. So it's like checking out, getting a car checked and ready before you go on a road trip.
That's smart.
So this appointment is also a good time to check on whether or not you're up to date on your vaccinations, whether or not your doctor will suggest that you use prenatal vitamins and or folic acid before and during your pregnancy. And it's also a time for you to share with your doctor all of the medications that you're on. That's prescription medicines and anything else that you may be taking like over the counter. Topicals, dietary and herbal supplements. I always tell people anything you put on you or in you, that's what you want to tell your doctor about.
Wow.
Oh, wow.
And then lastly, it's really important to take a minute at this time when you're planning to get pregnant to think about healthy lifestyle choices. Don't smoke, drink alcohol, use recreational drugs, because all of these things can hurt you and can hurt your baby.
Oh, yeah. Wow.
Sense.
Now, once you are pregnant, I heard there are certain foods that you should stay away from. What are those?
Okay, so let me first start with the foods you should get close to.
Okay.
So, so you want to make sure that you're eating a healthy, well-balanced diet, because this is going to help you provide the nutrients for your baby to grow and to develop. Now, there are some foods that are important on that list. So what are the healthy foods? Lean meats, fruits and vegetables, whole grain breads, and, of course, low-fat dairy products.
Really?
So what are some of the things that you should avoid, though? Because this is really an important question. These include things like refrigerated smoked seafood, raw sprouts, undercooked foods, and this one a lot of people don't know. Avoid milk, juice, and soft cheese products that are not pasteurized.
Wow.
So why? Because they can carry foodborne infections that can be dangerous to you and to your baby. And I'm going to give you an example.
Okay.
It's called listeriosis.
That sounds scary.
Yeah, it does sound scary, doesn't it?
Yeah.
This is a serious infection that's caused by eating food that's contaminated with a bacteria named Listeria. Now, this is important. Pregnant women are 10 times more likely, and Hispanic pregnant women 24 times more likely
Ay, Dios
Feel
mío.
personally
to
attacked.
get listeriosis than other people.
What?
Wow.
Okay?
Dang.
So we have to look out for this. Now, the trick in this, too, is that the symptoms for the mom, for the pregnant woman, might be mild. Think fever, flu-like symptoms. But they can be very serious for the fetus or for newborn.
Wow.
So what's important here, too, is that work with your healthcare provider. They can act as a partner, helping you figure out what the right, smart foods are for you to eat during your pregnancy.
So important.
Right? Well, Dr. Freda, our last question comes from one of our real fam in Downey, California. Her name is Crystal. She wants to know, how does pregnancy affect a woman's heart? Also, how is the heart affected postpartum?
So this is a great question. So pregnancy makes the heart work harder in more ways than one, right? In fact, the amount of blood in your body can increase by up to 50% when you're pregnant.
Wow.
Now, what that does is make your heart pump more blood out to your body. And this can cause your heart rate to increase around 10 to 15 more beats per minute. The other thing that can happen is the change in hormones can actually cause fluctuations in your blood pressure. These things in combination can make you feel tired more quickly or can cause shortness of breath while you're doing kind of physical activity. The other thing important to know about heart in pregnancy is if you have a heart condition, it's important to be evaluated before you get pregnant because you want to make sure that your heart can tolerate that additional strain. So you have to make sure that you're talking to your cardiologist and your OBGYN so that you have a plan for managing your heart condition and your pregnancy.
You never think of those things.
And then one last thing I want everybody to remember, and that is the heart issues that might be caused during pregnancy don't necessarily go away after you deliver. For example, if you experience high blood pressure and gestational diabetes, which is a type of diabetes that can affect up to 10% of pregnant women, you may be at higher risk of developing heart problems later on in life. And since each woman and each pregnancy is unique, talk to your doctor about what steps you should take to stay on top of your heart health before, during, and after pregnancy. Now, Adrienne mentioned a startling statistic at the beginning of the segment, but the good news is that data indicates that more than half of these deaths are preventable. Understanding the importance of and access to better quality prenatal and postpartum care is key.
Postpartum care.
Postpartum care.
It's really important. They forget about that.
Twice. Pumping all that blood in your heart.
Dr. Freda, thank you so much for stopping by and answering our real fans' questions. This is so essential. Make sure to visit Dr. Freda's website, gethealthystayhealthy.com. It's a huge, great resource. And for more information, please head on over to thereal.com.